New this morning, the crush of COVID patients continues to put enormous strain on Idaho hospitals, both in terms of available beds and on the medical professionals themselves. The state is in the thick of a fifth COVID surge. Medical professionals have been telling us the patients they are treating are younger now, many in their 30s and 40s, and nearly all who have COVID are unvaccinated. On Wednesday, the state reported numbers showing COVID hospitalizations and ICU cases dropped slightly from record levels. However, both categories are still well above previous totals. And this week, Health and Welfare Director Dave Jepson said we have not yet seen the peak in hospitalizations. As of Thursday morning, the state was reporting 749 COVID patients in hospitals statewide, down from the peak of 793. 196 of them are in the ICU, down from the peak of 213 the week before. Now, across the St. Luke's health system, 280 of their 632 patients admitted to the hospital are COVID positive. 61 of the 80 patients in the ICU are COVID patients. St. Luke says 100% of them are unvaccinated. Across the St. Alphonsus system, 160 of the 484 patients admitted to the hospital are COVID positive. A spokesman tells me St. Al's doesn't release its ICU numbers, but says its primary and secondary ICUs are full and they've opened another ICU space. Also, a majority of patients in the ICU at St. Alphonsus are COVID patients. Those numbers paint a picture, but you have to remember they represent people. During the taping of this week's Viewpoint, leaders with St. Alphonsus and St. Luke's talked about the COVID patients, the people they're treating now in their ICUs.
Our populations are much younger than what we saw a year ago in July, June area. We had sadly our youngest death from COVID this month, probably a couple of weeks ago, a 20-year-old. And when I go and visit with the nursing staff and I inquire about what's the age, and they're all between 30 and 50, early 50s. I think our hope is that people are listening and acting accordingly. We are still one of the lowest vaccinated states in the United States.
In our adult ICUs, our youngest patient today is 22 years old. About 70% of our patients are 55 years or younger in the intensive care unit. And in the intensive care unit, 25% are younger than 40. They're sicker, they're staying longer. Average length of stay in the ICU is up by 2 whole days, and their mortality rate is significantly higher than it was in the December surge.
The government and agencies just came out with some guidance for pregnant women, urging them to get vaccinated. What do you have to say about that, and have you had tragic situations there involving pregnant women at St. Luke's?
Thank you for that question. I really appreciate it. Absolutely. I think both of us on this call have seen this. Some of our most tragic cases have been young moms and their babies, and we've lost moms and we've lost babies. I'd remind everybody that pregnancy is a natural state of immune suppression. That is specifically how moms carry, foreign tissue. And don't reject it. So that immunosuppression in pregnancy is playing out, and we're seeing really tragic cases.
Now, they also talked about the enormous pressure and emotional strain their staffs are under and the adjustments the hospital systems have made to meet the challenges of the recent COVID patient surge. You can watch the full interviews on Viewpoint Sunday morning at 9 o'clock right after Meet the Press here on 7.